This week, member states from around the world are meeting in Geneva to discuss the new pandemic accord. This agreement is being developed, shaped, and decided by the 194 member states that make up the World Health Organization. Building on the lessons of COVID-19, I broadly see three key benefits. The agreement would help countries drive a more equitable response, it will boost collectively health safeguarding, and it will enhance cooperation. And when the next pandemic does happen, it takes a whole of society approach to tackle it. That's why member states are designing an agreement to support countries to mobilize all sectors in a coherent response, including across governments, multilateral agencies, the private sector, and civil society. There is a rich discussion going on about the agreement, which will happen for several more months to come. There is progress, and I maintain confidence that by the World Health Assembly in May this year, countries will have agreed on a new pandemic agreement that sets out a better set of parameters than we had during COVID-19. Ultimately, it will save lives and livelihoods while protecting national security and sovereignty. The health and humanitarian situation in Gaza is inhumane and continues to deteriorate. Over the past 3 days, WHO and partners have carried out several emergency missions to Nasser Medical Complex in southern Gaza. Around 130 sick and injured patients and at least 15 doctors and nurses remain in the hospital. With the intensive care unit no longer working, WHO has helped move patients, many of whom cannot even walk. On a broader level, Gaza has become a death zone. Much of the territory has been destroyed. More than 29,000 people are dead. Many more are missing, presumed dead, and many, many more are injured. Severe malnutrition has shot up dramatically since the war started, from under 1% to more than 15% in some areas, putting more lives at risk. This figure will rise the longer the war goes on and supplies are interrupted. We note with apprehension that the World Food Programme cannot get into northern Gaza with supplies. We need a ceasefire now. We need hostages to be released. We need the bombs to stop dropping, and we need unfettered humanitarian access. Humanity must prevail.
Humanitarian law is very clear. Healthcare workers and healthcare facilities are off limits. They must not be attacked. They must not be used for military purposes. They must be protected at all times. The protection of healthcare also includes the prohibition against combatants using health facilities for military purposes. But IHL is also clear that even if healthcare facilities are being used for military purposes, there are stringent conditions which apply to taking action against them, including a duty to warn and to wait after warning. And even then, disproportionate attacks are strictly prohibited.
Even war has rules. And what we're seeing increasingly, and we were discussing it before we came online today, the number of situations in which the basic rights of people, of civilians in war, are not being respected. Civilians have a right in war not to be attacked. They have a right not to be denied health care. They have a right not to be raped. They have a right not to be denied food. They have a right not to be besieged. They have a right to free movement. They have a right to congregate. They have all these rights. These are rights we all have. These are inalienable rights. And in conflict after conflict after conflict, they are being ignored and, to a point, weaponized.
Sudan, while not receiving much international media attention, is witnessing a humanitarian catastrophe. More than 10 months of conflict have had a deadly impact on the lives, livelihoods, and health of the people. Over 6 million people have been displaced internally, and nearly 2 million people have gone to neighboring countries. This is the largest displacement of people in the world. Half the population needs humanitarian aid, but partners cannot reach most of them. Already more than 14,000 people have been killed, and if the world turns a blind eye to the suffering in Sudan, many more will die. WHO is scaling up on the ground efforts to deliver health emergency response, respond to disease outbreaks, sustain disease surveillance, and provide life-saving medical supplies and equipment. After years of progress against cholera, the deadly disease has come roaring back in 30 countries, spurred on by conflict, poverty, the climate crisis, and global socio-economic inequality. Along with Sudan, the countries with the most concerning outbreaks right now include Ethiopia, Haiti, Zimbabwe, and Zambia. In October 2022, the International Coordinating Group that manages the emergency stockpile of cholera vaccines suspended the standard 2-dose vaccination regime in favor of a single dose only in response to outbreaks to stretch supplies. Despite this extreme measure, at the start of this year, the stockpile was empty. 0 doses are left, while 15 countries are reporting active outbreaks. We need the world to wake up to the rapidly growing threat represented by cholera. For immediate needs, WHO has released over $16 million from the WHO Contingency Fund for Emergencies. But to tackle cholera outbreaks around the world, WHO has issued an appeal for $50 million for 2024.
When we talk about emergencies or disasters, we assume we're going to be dealing with injured people, and people understand that. We assume that there may be epidemic risk because people understand that. But what's often forgotten is that displaced or refugee populations or populations who've lost access to their homes and their medicines or lost access to healthcare also lose access to care for long-term diseases like diabetes, like hypertension, people with disabilities, people with mental health conditions. When a community loses a primary healthcare centre, when a community loses its hospital, when it loses its immunisation programme, there's more than just a loss of health. There's a loss of hope. There's a loss of community confidence. And that often forces people to move and migrate and to move away from where they are, where they can't get services, to somewhere else, which then deepens the problem because the community that ends up hosting them is now providing care for more than the number of people they can care for. So it triggers a whole series of negative things. And we need health systems that are capable of both responding to the acute emergency and being resilient and being able to have continuity of services for all of the other diseases. So that's what we mean when we talk about non-communicable diseases and emergencies. We can't forget them and we must provide for them.